Hello, my name is Shelby Wynn, and today I will be talking to you, my audience, about joint movements. This is my joint movement project video, and to start off with it, I have flexion and extension as my beginners. So for flexion and extension, flexion is the decrease or decreases the angle between two bones, and it moves a body part anteriorly, while extension is the increase of the angle between bones and moves a body part posteriorly. For both of these, I have the same example. It involves the wrist. For flexion, I have wrist flexion, of course. Wrist flexion is the bending of the wrist so the palm moves towards the anterior forearm, while for extension, I have it for wrist extension, again, of course. So it moves the hand toward the posterior side of the forearm, and for both of these movements, the joint that is used is the condylar synovial joint. For my third and fourth movement, I have abduction and adduction. Abduction is movement away from the midline. Is movement away from the midline, and then adduction is movement toward the midline. A good example or a good video I watched that helps me remember a little better between abduction and adduction is that a guy had told the audience that when you think of abduction, you think of abducting. And when you think of abducting, you think of taking away. So whenever I think of abduction, I think of that. Abduction, abducting, taking away. So for my example for abduction, it would be my palm. Let me put it over that. So when I think of abduction and the example I used taking my fingers away from the midline or the middle finger. So all I am doing is just taking my fingers away. And then for adduction, what you do is you move your fingers back towards the midline. So you just put them back together. I also used another example of the thumb, which all you do is for abduction, you just pull it away, and then adduction, you just pull it back. For the fingers, when you do adduction and abduction, they both use condylar synovial joints. But if you were to use your thumb, pulling and pushing, or pulling it away and then putting it back, it would be the saddle synovial joint. All right. For my next movement, 5 and 6, I have elevation and depression. For elevation is the movement of a body part superiorly or upwards. And then for depression, it is movement of a body part inferiorly or downward. For my example, it's the same example for both. I used lifting your shoulders / scapula. Scapula and clavicle, those are the bones that are used when you use your shoulders. So when it's elevation, all you do is move your shoulders up like this. I have too much hair. You move your shoulders up, and then for depression, you just bring it down to the anatomical position. For both of these, the type of joint that is used is a ball and socket joint, seeing as how it's in your shoulder. For my seventh movement, I have hyperextension, which is extension beyond normal range. For that, I have two examples. One is of the wrist, and then the other is of the knee. Let me go ahead and show you the knee real quick. Now, for the knee, for my example, for the knee, For hyperextension, it's when you're going past your normal range. So this is my normal range. And then I'm trying to show this is the hyperextension of when it pushes itself farther past, of course, its normal range. And then with my wrist, my example would be, let's say if I were to accidentally fall and I would be pushing, on my hand and pushing my wrist past its normal range point. And then, so for number 8 and 9, I have pronation and supination. Pronation is when the palm faces downwards. The example, of course, would be this. And pronation is when the radius rotates over the ulna. With pronation comes supination, and supination is when the palm turns or palm faces upwards. For supination, it has the radius and ulna, they are at parallels. For 10 and 11, I have dorsiflexion and plantar flexion. These are both in your feet. Now for dorsiflexion, it's when the foot bends upward toward the shin. And then for plantar flexion, it's when the foot bends downward toward the sole. Both of these use the joints they use for both of them is a hinge synovial joint. Now for number 12 and 13, we're still talking about our foot, but instead of going up and down, we turn inversion, which turns medially like this inwards, and then eversion, which turns outward or laterally like this. For 12 and 13, inversion and eversion, they use a plane and saddle joint. For my last movement, I have rotation, which is when bone rotates around its long axis. For my example, I use the head rotation. So for the head rotation, you use your neck and your shoulder internal / external rotation. For the joints used for the neck, you use a pivot synovial joint, while in the shoulder, you use a ball and socket joint. Thank you for watching my video on movement joints, and